I think that as we have seen in the presentation of the cell therapy day regarding the virus-specific immunomonitoring after the transplantation, it is important to reach for all the EBMT center a standardization and harmonization. We have really several type of assay that we can use. For example, for the CMV, we have the QuantiFERON that is more simple to perform and highly standardized because it can be performed in routine lab. But as a limitation, we have seen that it can only measure CD8 positive cells. It's sensitive to lymphopenia, so it's difficult to perform in early time points after the transplantation, and also in patients who have lymphopenia in other complication such as GVHD or poor graft function after the transplant, and it's HLA restricted. We have also another assay that is ELISpot. This type of assay, it's highly sensitive, but as a limitation, there is a sort of lack of standardization among centers. So at some stage, although we have some standardized kit, each center has to perform in an operator-dependent way. So this can be a limitation for this test and the comparative studies among centers, and requires also an hard working from the lab because it requires PBNC isolation. Finally, we have seen also a new assay by Dextramer that increased the detectable fluorescence intensity and improve avidity. And this is important because we have seen that we are able to see the virus-specific T-cell more early in the post-transplant setting. At 1 month and 45 days, we are able to see the specific against the virus responses. And there are some limitations also for this assay, that it can measure only CD8 positive cells. It's once again HLA restricted, but the kit is standardized. So I think that for the future we have a lot of assay in our hand, and we need a standardization. What we are currently using, for example, in my center in San Raffaele, it's to use, for example, Dextramer in the cases in which we are lymphopenia and in the early 10 points after the transplant procedure, while using QuantiFERON, for example, that is more widely used and more easy to perform in the long-term follow-up. An additional possibility that we have with Dextramer is that we can measure also in the case of a transplant with mismatch the different participation of immunoreconstitution by share host and donor components, and this can be of interest for the future. Regarding ELISpot, I think it is important to underline that also we are using this test because there is the advantage to look not only at the CD8 positive cells, but also at CD4 positive cells that can give also an additional contribution to the immunoreconstitution of our patient. And in general, if you are looking at ELISpot, you could have also a sort of surrogate marker for overall immunoreconstitution and protection of the patient against a lot of infection, not only related to a single pathogen.